How you feeling today, Nate?
Okay.
Excited?
I'm excited. It's poke holes in my face day. It's great.
Poke holes in your face, honey. For those of you who don't know me, my name is Beth Mingstu. I'm a board certified nurse practitioner. I own my own tiny med spa called the House of Aesthetics. And today I am going to be microneedling my friend's face. It is actually a radiofrequency microneedle. And we're going to use the Virtue machine. It's kind of equivalent to the Morpheus, but these are different brands of machines. So we're going to go ahead and start. I'm going to lift this up a little bit so I don't break my back. I'm just going to go ahead and fast forward through this. There's nothing pertinent here. You remember when we did this last month?
Mm-hmm.
Did you feel any discomfort?
No. Little small pinches, but it didn't hurt at all.
Okay. Your skin is looking good. I do see some improvement. So I am excited. I think that this, like a series of these treatments is going to really help you. Awesome. Just going to go ahead and skip this section as well. For my audience, so Naton has very textured skin down here. You can kind of tell maybe it's from like acne scarring or something. Mm-hmm. So this service that we're getting ready to do is actually going to puncture. With computer delicacy, it's going to puncture a whole bunch of holes in his face. They're not visible holes, but like he said, you can kind of feel it a little bit. Some people offer lidocaine or tetracaine, one of the canes, like as a medication to kind of like numb the face. But because my machine is like computer precise needle punctures, it doesn't hurt as much. I think the first puncture, you can kind of feel a little bit of a tingle, but after that, it's usually very, very elementary and very, you kind of get used to it. So I'm gonna start off by cleansing his face. We are going to do isopropyl alcohol. You can wash your client's face also. I just use the alcohol and Puricin to make sure that he's very, like his skin is degreased. And just another fast forward here. So remember, Nate, it's gonna be, you're gonna get a whiff of alcohol. So just do a gentle cleanse with alcohol. Again, this step is because you wanna make sure the skin is disinfected and you wanna make sure it's degreased. You kind of want it a little more on the dry side when you're doing this procedure. Next, I'm gonna follow up with some Puricin, which is wound wash. Just give a little added antibacterial effect. This one doesn't have as potent of a smell. You doing okay? Mm-hmm. Perfect. I'm gonna do level 3 to start. Since we're going on the forehead, I'll do a lower depth. This is my wand. Again, this is the Virtue Radiofrequency Microneedling machine. I'm gonna turn up the depth just for the camera to see the needles. And then I'll turn it back down. So this is the needling here. Not sure if you guys can see it, but that's what it'll look like. So I can control the heat on here, I can control the depth, and I can control the amount of time that it's going to, the needle is gonna stay in his skin. So I'm gonna go ahead and start, okay? You want to make sure you overlap. We've discussed this with Nathan last time he got this done. And it doesn't matter where you start really. The forehead is a little bit more bony, so you don't have to go too deep because you'll make it uncomfortable. But you want to make sure you overlap because you don't want to leave scarring or any non-needled areas. This device is basically producing swelling and inflammation in your skin deep down so that we can regenerate new, healthier cells in a quicker amount of time. You want to hold it kind of 90 degrees or as 90 degrees as you can to their skin. And if you do a little too much overlapping, that is okay. Better to be safe than sorry. How are you feeling, Nate?
Good.
Whenever you see these fast-forwarded sections, just carry on. There's plenty of them in this clip. You can go in whatever direction you want initially. I just always do this because this is a little bit harder for me. So easier to just knock it out the way. This procedure really doesn't take very long. You could probably, I would probably block out an hour just in case of your time because you never know if somebody's behind or if they have to do additional things. And sometimes some professionals will put a mask on after this, and you'll see me put a mask on him. So you want to kind of just make sure that you're giving yourself enough time. I'm gonna have you turn your head that way. And it's okay for the skin to be slightly pink like this. That's what you want to see. You kind of just gauge to see how pink or red your patient is. You know, of course you don't want to overdo it and have them be red as a tomato, but you do want to see some of this skin color change because that means that you are, you know, producing your response that you're trying to elicit. I'll go ahead and turn your depth down for the second pass. Okay. Second pass is opposite direction. So forehead is done. Now we're gonna progress to the cheeks. I'm gonna go through and change the depth again. So he's textured on his cheeks. I can probably honestly, because it's all the skin at the top, the superficial layer that we need to focus on, so I can probably make sure that the depth is a little bit shorter, because we don't have to go too deep to kind of try to correct that. I am going to turn up the heat just a little bit this time, so if you get uncomfortable, let me know and I'll go ahead and turn it back down. Okay, I'm gonna have you turn that way. Thank you. You doing okay?
Mm-hmm.
You don't want to go in too hairy areas, like heavily bearded areas, so I'm just kind of gonna realign this one. You can kind of go close to the eye, but I would probably say about there. So then I'm gonna have him turn this way, and I'm gonna do the other side. Okay, I'm gonna have him turn back, Nate turn this way, and I'm gonna go in opposite direction. I'm gonna turn down the depth even more. My audience, as you can see, his skin is pink. So I'm just gonna stick with 2 passes on him. You could do more if you want. The device does show you how many pokes that you, or how many times you insert the needles into skin. So he's pink here, and he's decently pink there too. I think that's good. Again, like I said, I'm one of those practitioners that doesn't like to push things to the limit. So we're gonna go ahead and do this side. I'm gonna have you turn that way. It get tricky in certain areas to hold this thing 90 degree, like at a 90-degree angle or perpendicular to the skin, but you kind of get used to it after a while. Okay, next we'll do the chin area, but I'm gonna go around. I'll do the lip and chin area, but I'm kind of gonna go around the hairy parts. I'm gonna go ahead and turn the heat down. turning it down even more. The depth, that is, I'm turning down. You don't really have a lot of options with this area, so basically you kind of just go where you can and in whatever direction you can. I just go across like this. And lastly, we're gonna do the nose. Okay. The nose is usually curvy, so you have to find yourself doing stuff like this. Basically adjusting your wrist. And I'm gonna hit it, well, I'm gonna hit it one more time here for him. Okay, one more pass. He does have a textured nose as well. So again, when you go in those areas, you don't have to go deep, because with the skin you're trying to really focus on is at the top. So for him, the amount of times that I pricked his skin is 533 times, which is fine. Some people can go up to like 1,000 or a little over that. So now the next step with him, I'm gonna go ahead and clean him again with the wound wash that I was talking about. Pearson wound wash. He's nice and pink. And I'm going to culminate with a calming mask. It has caffeine in it, hyaluronic acid, and aloe. And then I place an ion mask on top of it. So I'm gonna come to the side of him. So we have the microcurrent dual face mask. That's the one I was just telling you about that I place on top of him. And then I'm gonna place the microcurrent, which this is the microcurrent mask on top. This is gonna help not only hydrate, but it also helps to calm the redness down. You'll see his skin will kind of get a little more, like it'll get back to baseline color, or at least close to it. There is a lot of goop on this mask, so I usually send my clients home with the excess that they can use, because they should not be putting anything on their skin for the next 4 to 6 hours. Besides sunscreen, you gotta protect it from the sun. And I will wipe your lips off for you.
Thanks.
Sorry. Sorry, that's my hair again. I probably should have clipped my hair up today. It's not a good look. sting a little bit. Nate, I just realized I literally have this on top of your crotch. I'm sorry. I'm like, oh, I'm so glad we are close friends because honey. Wowzers. Then I'm gonna set my timer for 20 minutes, and you can sit there and relax and let that do its magic. Okay, so as we see, it's been 15 to 20 minutes. The mask is pretty dry, so I'm gonna go ahead and remove the mask for him. And this is what I was saying when I said his skin should look calmer. You could see some of the pink went down here. Now he looks kind of like a glowy, radiant skin color. So Nate, let's go over the post instructions. I did this last time for you, but sunscreen.
Okay.
Nothing on your face for 4 to 6 hours except sunscreen, and then like you can use this serum if you feel a little irritated. Like I said, if you're going to be out in the sun, try to put a visor or a hat on, just because your pores are open and you don't want them to burn.
Okay.
No harsh ingredients in any, like don't put like a mask on or wash with like a salicylic wash or, some kind of exfoliator. Just gentle products, like gentle foaming or even like milky products for the next day. And then also don't get any other aesthetic procedures done, which I don't think that's going to be an issue for you. If you, like I said, if you go outside or, you're going to do your activities, try not to sweat too much. I know you're going to go do some sports things later, but we did this early enough to where you should have some time to cool off before you start sweating.
Okay.
But really, that's it. I think after like 2 to 3 days, your skin should be okay. It's going to be like kind of how it was last time. Relax, calm. We should start seeing changes in the texture of your skin here. But like I said, we'll finish out your series. I'm going to give you like 1 or 2 more series, and we're going to see we're going to kind of compare it to your before and after pictures.
Okay.
So I'm very, very happy. I love you so much. You're one of my dearest friends. You're the best photographer I know, and you are highly supportive. And I really do appreciate this, Nate.
Absolutely.
We have finished our service. Thank you.